Welcome to the Strong Youth Project, where our mission is to improve organized sport experiences for youth, parents, coaches, and other mentors via education and evidence-based practice. Welcome to the Strong Youth Project podcast. As we work to improve organized youth sport experiences, we will share insights from both scientific research and real-life experiences. Although we will present evidence-based information from the highest quality scientific sources, we also recognize the value of firsthand experience shared directly from athletes, coaches, and parents. These experiences may not always align perfectly with scientific research, yet we believe they still offer important insights into how best to effectively facilitate the many benefits youth sports can offer.
Welcome back to the Strong Youth Project podcast. This is part one of a two-part series talking about concussion. In part one, we're going to cover the identification and prevention of a concussion. My name is Bree Campbell. I am an undergrad at BYU studying exercise science.
And I'm Alex Bingham. I am in my master's program of athletic training currently right now at BYU. And we're joined by some fantastic physicians here and neuropsychologists. So, Dr. Campbell, would you like to give a little introduction about yourself?
Yeah, my name is Darren Campbell. I'm a sports medicine doc. I'm currently working as the BYU Head Team Physician. And I work at Utah Valley Orthopedics and Sports Medicine. And there in our clinic, in our sports medicine clinic, we have really kind of a subclinic, and we call it the concussion clinic, where we see concussion injuries from sports of all kinds, as well as just life, as life deals them out.
And my name's Marc Steed. I am a clinical neuropsychologist. I also work in the sports medicine and orthopedic department at Utah Valley Hospital in the concussion clinic with Dr. Campbell. And we see patients together and help identify, diagnose, and treat concussions.
Awesome. Yeah, let's dive into it. We're going to talk a lot about concussion today. So our first question for both of you is, what is the definition of concussion? And either one of you can start if you'd like. So.
Okay. You want to give that a go?
Sure. It's when you sustain some sort of mild traumatic brain injury, and that's usually due to some sort of external force to the head or the neck or the body, in which the brain kind of contuses or sloshes around inside the skull a little bit and results in some dysfunction in how the brain is working.
Yeah, and I think from a sports medicine side, we see that a lot with athletics and sports. But what we're talking about is that forcible blow. And the definition is really important because how we handle someone who gets hit in the head is different. Sometimes you can have a big blow to the head and you don't necessarily sustain a concussion. So you have the forcible blow, and then we have the side effects. And you can, if you lose consciousness, you have a concussion. Certainly. We're looking for any sort of neurologic change with that. So if you lose consciousness, even if you're normal after you wake up immediately, you still have a concussion, but it doesn't have to be that. And we get that question all the time. I wasn't knocked out, so I must be okay. I just have a severe headache and I feel nauseated. So there's other symptoms you can have with that. So that definition is important for us as medical providers and for athletic trainers that are out there, people on the front lines taking care of it. But I think as we look through that definition, it's important for families and athletes that are participating to kind of become familiar with that.
Yeah. And I would add coaches as well. I mean, sometimes there's a lot of pressure to have these athletes who are incredibly skilled be pulled from a game.
Yeah. So I think that community awareness is really important in kind of having those definitions. So those definitions come from, we have a consensus group every couple of years that meets and defines that for sports. So the most recent iteration came from Amsterdam, and we have our worldwide national experts meet and sort of talk through those definitions. And so if you look up the concussion consensus statement, you just search that, and you can throw in the name Amsterdam if you want, and you'll be able to see all of their findings. And that's what we rely on. Every couple of years, they'll have a new update for that, and that's what we use to sort of guide our practice and help with that.
No, that's super interesting. Yeah, I think that's an incredible definition. To kind of explain what that is, I think a lot of people question, well, what is a concussion exactly? a lot of people don't know that definition. So thank you. Yeah.
And tell us just a little bit about how both of you got into studying concussion.
Well, as a neuropsychologist by definition is part neurologist, part psychologist. So I'm interested, of course, in behavior and moods and emotions. That's the psychology part. And then the neurology part is how brain functioning affects those things. And so as an undergraduate here at BYU, I was at a presentation by a guy that they brought in from Texas. His name's Aaron Bigler, and he was phenomenally well respected in the field. And I heard him speak, and I just knew that that's what I wanted to do. And so, of course, being interested in brain functioning and behavior, concussion is a natural extension of that. So many of the people that we see with more serious brain injuries, it's pretty clear what to do for them, how to help manage them and admit them to the hospital, get them through the course of rehabilitation. But individuals with concussion, it's much more mild. And so I was working up at Intermountain Medical Center when one of the neuropsychologists there, Ann Russo, reached out and asked if I would help her set up a concussion clinic for high school athletes at the orthopedic specialty hospital there. And so that's when I got interested in that. And that was in the early 2000s, and it's been interesting ever since.
That's awesome. Yeah. Thank you for sharing. Yeah.
Yeah, and for me, I mean, it was a natural offshoot of being a sports medicine physician. So as I take care of, team athletes from youth sports to high school sports, into college sports. So, my real interest and start of research started when I was at the Air Force Academy as their head team physician. And it was there as we were following, we felt like we were taking care of the athletes, as well as anywhere. And then we started to look at all of the other cadets at the service academy and injuries that would happen in there when they were doing other things, sometimes intramural sports, but sometimes military training and other things. And at one point we sat down and said, I don't know if these folks are getting recognized and treated the same way that we're taking care of athletes. And so that was one where we sat down and started to look at sort of best standards in the country and looked at one of the big sort of groups in that field was the University of Pittsburgh and Mickey Collins and their groups. And so we were able to work with them on a few cases, and they were setting up a new clinic at a different university, and we asked if we could go. And so we went there with them and came back and said, all right, here's kind of a game plan, and we want to start to bring together all of these specialists like neuropsychology and sort of bring these folks together, make them accessible, and sort of just solidify how we take care of concussions, both the athletes and in that case, these cadet non-athletes. And so that's where just trying to look at it and say, I don't know if we're doing this the right way. What's the need? And it just blossomed into a lot of research and a lot of interest, and hopefully we're headed the right direction.
Yeah, absolutely. Wow. Both of those are incredible experiences. Yeah, thank you for sharing.
How have you guys seen the treatment of concussion, or just the topic of concussion being approached, and how has that evolved from when you started practicing as a medical professional until now?
Yeah, night and day difference. I remember back in the day, the mantra was if you get a concussion, and usually it had to be pretty serious. Most of the time when you got your bell rung, the coach would say, hey, great job, get back in there and do it again. And then when you were injured, it was let's sequester you in this dark environment and isolate you from everything until you get better. Mm-hmm. And that's not what we do nowadays.
Yeah, it's definitely changed. And we've seen that. We even, as we look at sort of the literature and the things that guide the way we approach it, it's changed dramatically. In the early 2000s, as we've done some research and worked with different groups around the country, Mike McCrae at the University of Wisconsin has been one of the leaders in that. And so he published a study in the early 2000s or late 90s, and they talked about what's the normal time frame for a college athlete. And the pro athletes were even shorter than this, where they're returning back to sports at a week or less. Wow. And so as we've now spent a lot more time researching this and starting, kind of 2014 and beyond, as we've had a lot more money spent on research, now the average return to play time for a college athlete is closer to 2 weeks. Mm-hmm. And how we handle them in that time frame is different. So we've been able to see, really with science, trying to dive into that, some big changes in the way that we handle concussions. And then another big part of that's all of the education, right? It's certainly come to the forefront as we've looked at some potential problems with some of our pro athletes. Sometimes that interest in that and that sort of being out there as, high profile kind of situations does help drive some research and interest. And so for us, it's always a challenge to separate out what's the hype or the sensationalism around it and then what's the science behind it.
I would also add, I think Dr. Campbell just kind of glossed over this CARE Consortium study or database, but really that is kind of an amazing piece of work, and it informs a lot of our concussion care, and so it's pretty great that he was able to be a part of that. So
Yeah, absolutely.
yeah.
Can you tell us just a little bit more about that DOD NCAA CARE Consortium that you were talking about?
Yeah, it was kind of a
helpful.
brainchild of, we had some DOD folks in the military. Concussion and head injuries has been a big part of sort of the efforts that we've had, in all of the different war efforts that we've had, as we look at blast injuries. And so the Department of Defense was very interested. And then as we looked at the NCAA and trying to take care of our athletes, a big interest. And so we had really two of the big thought leaders from each of those groups put their heads together. And with that, they kind of came up with this project. And they looked at it and said, that DOD and the NCAA, they're going to combine and put in some money and let's do some research and let's look at these and how do we kind of help each other out. And so initially, they put together a group. It started a little bit smaller, but they had 30 institutions around the country, and that included our military institutions. So we included West Point, the Naval Academy, the Air Force Academy, the Coast Guard Academy in that group.
Wow, yeah.
And so we looked at that and said, how can we track and follow individuals who sustain a concussion? Does that translate to other sources of concussion as we kind of do that? And really, even to date, that's the world's largest concussion study with the most number of injuries to kind of help push this forward. And we've seen the number of publications from that is dramatic, and it's changed the way we handle concussions.
Yeah, they're still doing publications from that data.
Right.
Yeah, it's
That's
amazing.
Incredible. Yeah, no, that's incredible. I think the person that was over some of those studies and helped with that, Steve Broglio, I think.
Mm-hmm.
Even in the MAT Master's Athletic Training Program at BYU, we read through those paperworks that he's gone through all the time, and he discusses that project overall. So I think that's really
nice.
cool.
And that's a great group. We were actually able to bring him out at Intermountain. We've had a concussion conference every year, every other year, just depends on the year. But we talked to them, and certainly with contacts from the CARE Consortium, we were able to bring him out and have him, talk about the CARE Consortium and even our local conference. Mm-hmm. And it's incredible, that community. We have a lot of people that are driven and really interested in that, and they're making a difference. So that's certainly, for us, that's what makes us interested in this topic, right?
Absolutely.
Yeah.
So we're changing the topic just a little bit, not too much, but they put a poll out on Instagram to see what questions people have about concussions for the Strong Youth Project. And so one of the questions that came back, which I think is a pretty interesting question, and you can give your best answer, but do you think concussions preventable?
That's a great question. I would say no. I don't. I think the nature of the activities are for some sports, like rugby or football or ice hockey, even cheerleading, right, where there's a propensity to get hit hard or to have a fall. I think it's inevitable. I think there are things that can be done to prevent them, but in my understanding, I don't think protective equipment necessarily prevents concussions, but it prevents serious brain injuries if it's utilized properly.
Yeah, so that's kind of a loaded question, and there's not a simple answer. I agree with that. As we look at this, we were able to look at a few things with this in that Air Force research, right? We have all these cadets in a pretty closed environment. Everybody has to participate in military training and intramurals, and then of course we have intercollegiate athletics. So you have about 4,500 individuals, sometimes at different times of the year. It may push that number a little bit. Yeah. And so one of the things that was interesting there in that community, they recognize there's certain parts of their training that they're not willing to sacrifice, even though there's some concussion risk, right? any of us could go out any day and slip on the ice and hit our head or get in a car accident.
True.
And sometimes we choose to participate in sports that increase our risk. And the benefit from sports we know is so great. We don't want people just to sit on their couch, and playing video games may do some other things for us, but it's not the same as sports.
Not at all.
And so that, we want to do those things. So as we looked at that, just as an example, they looked at boxing classes at the Air Force Academy. And so what they found with that is they had a higher number of concussion injuries from these from these cadets that are participating in their boxing classes than they did from their boxing team. They have a competitive boxing team. Naturally, you think of boxing, getting hit in the head a whole bunch of times is going to result in a lot of concussions. But what they found there is they looked at the numbers. They have lots of folks that have never done anything like that in their life, and so they looked at that. Can we decrease the number of injuries? Because that was their highest sport or activity that brought injuries. So they broke it down and looked at everything. They looked at all the aspects of that. When they're doing that, what time of year, are the cadets just coming off of basic training when they're so fatigued and tired? As they looked at their curriculum on what they teach or how they teach their boxing class. And what they found is, as they sort of turn people loose, those that sort of had a propensity to that would jump into the ring and they would just start throwing haymakers, big punches, just swinging wildly to hit people. And when those connected, they sometimes were hard enough to cause a concussion. What they did is they pulled back on their curriculum and said, okay, we're going to teach everybody all of the basics of boxing, your footwork, your defensive positioning. We're not going to let people throw any power punches until we get to lesson number 8 or the number they had. Now that they have basic boxing skills, we feel like we can let them start to throw harder punches because people know how to block those or move out of the way. And they saw a drastic decrease in the number of concussions they had from their boxing class. So even though it can be inherently part of our life, let alone sports, the way we handle some of those things and the way we look at them and treat those in sports, we can do some things that can make a big difference.
Yeah, and I think along those lines, I think, coaches have the opportunity to help their athletes develop and to become more comfortable, say, handling the ball or doing a particular move. And so they have an opportunity to teach them those skills at a slow pace in a practice environment, get their body kinesthetically used to that kind of movement. They rehearse that muscle memory, and so that when they get into a situation where they are at risk, they're trained on how to respond and know how to protect themselves.
Yeah, and it goes down to all of those things. So we need buy-in from everybody, parents, coaches. Some of the youth leagues are starting to do this. So at our annual conferences, we have an American Medical Society for Sports Medicine. That's my group, my conference that I attend every year. So they've worked with USA Football, USA Hockey, and they're starting to make some changes. Simple things like you can't check someone in hockey where you slam them into the wall until a certain age. We're not doing tackle football with full pads where we're hitting people in a certain way until a certain age. And then, of course, the technique of doing that, right? Yeah. You're not diving in head first. And so as we teach, we've seen many NFL projects for the youth, heads up tackling, heads up football. That's making a difference. Yeah. And then we're seeing the feedback at the professional level. We all saw this year a difference in the way that they kicked the football off in the NFL games. If you notice that was done directly in proportion to the number of injuries and primarily head injuries that they sustained in those athletes during kickoff. So they said, we don't need that. We can still have a game and not do that. And it'll be interesting to see as we go forward the overall numbers and how that sorts out.
Yeah,
absolutely. Yeah.
Thank you. Because it's just so interesting as science evolves, we apply those teachings and we apply what we're learning to the real life situations in professional, in university, in high school or youth levels. So that's super interesting.
For sure.
Yeah.
We're going to shift focus a little bit to youth sports because the mission of the Strong Youth Project is to improve youth sport experiences for all stakeholders. And so the first question that we just want to ask is, what are the biggest risks for concussions in youth sports?
So I can address that. It's just some of the things we talked about, right? So you're playing sports, you can have contact with another person, contact with the ground as we're doing that. And that's where just some of the things we mentioned with some of the youth sports, changing the age as we start to get better technique, as we start to get coached up better, looking at their age progression and how strong they are. There's differences in ages, and really trying to build the rules and practices of that sports around those age-appropriate sort of growth milestones. I think we need more science behind that, but I think we're headed in the right direction for that. So that's really one of the biggest ways that we can help protect against that for youth sports.
Just a follow-up on that, should parents consider waiting to put their children into sports until a certain age, until they have the muscle tone to sustain that kind of impact?
That's a hard question. So in today's world, youth sports is driven by a lot of factors. And I think we've talked about this, with the Strong Youth Project before. There is an age right now, and it's sad. I saw a patient, it's been a little while, who came in at 13, and she was playing softball, and her friends were all playing youth soccer. And she was in tears saying, well, I can't play soccer, I'm too old. I'm too old at 13 years old to join youth soccer because I'm not going to be on an elite team, and I can't play with all my friends because they're at a tier. I'm like a beginner, so I'll never make it. And it broke my heart, and clearly there's something wrong with the system when we have a 13-year-old that can't enter that. So our youth sports programs are driven by a lot of things. We have these programs that select elite athletes, and you're on these travel programs, are time intensive, they're costly, so parents and families are spending lots of money for that. We have coaches that are better quality coaches and better quality systems that are making their living off of that because it takes so much time. Mm-hmm. So that system has to make some changes from a safety standpoint. That system needs to be more in tune with the developmental process for our youth, or it's not gonna survive. We in sports medicine clearly support participating in sports, even some of these sports that have a little higher risk.
For sure.
We think that's so vital. We think it's important. We want those to continue, but I think you have to make some changes, or it's gonna create a situation where, from a safety standpoint, you're not going to continue because there's obviously some problems. So that's a hard thing to do. But yes, I think some just maybe oversimplified answers to that would be, we're not having contact until a certain age. We are developing the skills before that. We should have more flag football leagues that are there. We should even have leagues that people who don't make the elite teams can participate in, and enjoy the sports, and then maybe transition to that if they have those skills. And we don't. It's all focused on these elite sports, and you're either in that at a young age or not. And then, of course, during the time I grew up, you didn't play sports all year round. We played different sports because they didn't have these leagues. And we know from our medical communities that's a better system, so we're not having the same overuse, repetitive injuries, the risk. We kind of characterize your risk for concussions as risk per practice encounter or risk per number of plays or those kinds of things. And so if you change that equation, you change your sports, you change that risk of having a concussion. So I think there's a lot of work to be done in that process.
Yeah. And if I could just pontificate for a minute, I think that the idea of specializing so young is not really healthy from a psychological perspective either. I think, as we learn and grow and develop, we have a pyramidal type of learning experience, right? A broad base. Mm-hmm. And then as you get older, you specialize in the thing that you're interested in. Mm-hmm. And I think that that's important in sports too. The benefits of sports for children are amazing. Physically, being part of a team is such a great thing for them developmentally to feel like they're part of something that they can contribute to a greater good, if you will. And I think just to reiterate, from a psychological perspective, that's a healthy approach.
Absolutely.
That's super interesting. I never even thought of that.
Yeah.
The aspect of
No, that's
that.
Yeah.
But also along the lines of risks, as youth are developing, their brains are developing, because your brain doesn't develop until you're an adult. What are the long-term risks of a concussion on a developing brain?
Yeah, that's a great question. And, for a long time, science thought about kids as little adults. And we now realize that that's not. Little humans are little humans, and they're different. And there's a lot that we don't know about the impact of concussions on the pediatric brain. you've got a lot going on there, right? We are developing, our brains are developing, and probably until our mid-20s. It's downhill after that. But up until that point, you have development going on, and it's huge. It's hormonal, it's physical, it's neurological. All of these changes are taking place. And then when you damage or you disrupt the regular functioning of something, it may take longer for a child to recover from concussion than it would an adult. Usually, there is no clear-cut criteria for when is enough concussion. What is the magic number at which I should stop doing my sport or stay away from sports? I don't think we don't know what that is, right? But we do know that it's important to make sure that when a child does get a concussion, that they take the steps necessarily to gradually return to not only their sport, but to their job. And their job is academics in school. And making sure that they take the time to recover completely from that before they put themselves at risk for developing or experiencing another concussion.
Yeah, absolutely.
Perfect. Something that my high school always emphasizes, that you're a student athlete, and student always comes before athlete. So you have to make sure that you're able to return to school first before going back to your sport.
Yeah, no, I love that.
Those protocols are important, and we have, in Utah, we have legislation that regulates return to sports, certainly for our high school athletes, on when you can go back. There's set protocols and criteria you have to follow to do that. It's part of the law. But we sort of left out return to learn or return to life, however you want to phrase that, and the importance of that. Now, there's a few school districts, well, one in particular in Utah, no other school districts have done this. Alpine School District spent some time trying to address that, but it's just not widely focused on. And I think that's probably the biggest thing. We always focus on return to sports. That's the very last thing we add at every level. Even in college, if you're trying to return to sports after a concussion, you don't return to sports until you're back doing your full academics, you're back to normal life, you've recovered from that, your life is normal after a concussion, and then we bring back that extra risk from a concussion. And I think that should follow true at all levels.
For sure. I think that counts for any injury almost, right? You're coming back from something that's hurt, let's say a hurt muscle in that case, right? It's the same process. You're not going to jump right back in. So
yeah,
it's the same process.
And it's a stepwise progression, right? It's sometimes these high performing individuals, these young children are smart and bright and driven, and they feel like, well, I'm feeling a little bit better, I should be back to being 100%. But really, it's a stepwise, little by little progression that, get introduced a little bit more. Can you tolerate that okay? Are you asymptomatic at that level? If so, then let's introduce a little bit more and kind of work your way back through that. And that's kind of hard sometimes for these high-performing individuals.
Really, one of our main tenets for concussion care is the most important part of taking care of a concussion is that you're completely healed from that concussion before you go back and potentially get another concussion. Yeah. Even at the level that we're seeing from NFL and some of the controversy around CTE and those processes, that tenet really holds true. If you have a concussion, we want you all the way better. Your brain can handle another insult or challenge if it's completely healed before you go back.
No,
Right.
I think that's huge. Sorry.
Yeah, no. So think about it for a minute. If your brain is impaired and your reaction time is off or your visual perception is off, you put yourself at risk for developing another or sustaining another concussion because you're not at 100%, right? And so that risk of a second impact, they call it second impact syndrome, can be devastating. And so it's really important for these youth and those involved in their well-being to take this seriously and help them play the long game so that they get completely recovered before they get back to doing what they love.
Absolutely, yeah. No, I think that's perfect answer, super important. I think a lot of times athletes will hide or not even want to mention that they have symptoms. And so that's an issue. Just like we were talking about culturally, we need to make some changes, right? I just want to say a huge thank you to Dr. Campbell, Dr. Steed for coming on today for the podcast for the Strong Youth Project. This is part one of part two. So we're happy to dive into part two with you guys soon.
Yeah, you bet. Thanks for having us.
Thank you.